Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer DeSablo, your host for today's show. Through this monthly show, Franklin County Home Health Agency is proud to bring you information about the agency's programs and services, as well as helpful tips to help you stay safe and healthy at home. Before we get into our topic today, I want to let our viewers know about a special incentive that Franklin County Home Health Agency is offering to viewers. To appreciate that you are watching our show, we ask that if you'd like to be entered into a drawing for a $25 gift card to Hannaford's, you can call our agency at a special voicemail we've set up at 802-393-6798 and leave your name, phone number, and address to be entered into this special incentive for a $25 gift card. Again, that number is 802-393-6798, and we're happy to do that for you. The drawing for that will be held on May 1st, so if you catch this show, give us a call by May 1st. So today we will be revisiting a program that we've talked about before on the show. It's one of our newer programs, the Nurse-Family Partnership. And the Nurse-Family Partnership is a maternal and child health program that helps vulnerable first-time moms and their families, and it's also helpful for our whole community. So I've invited Rhonda DeRocher, a nurse supervisor with Franklin County Home Health Agency's Nurse-Family Partnership program, to talk with us today about that program. So thank you for being here, Rhonda.
You're welcome.
So tell us again what Nurse-Family Partnership is and how it got its start in Franklin and Lamoille counties, I should point out.
Well, Nurse-Family Partnership is an evidence-based nurse home visiting program, and like you said, it partners vulnerable first-time moms with a caring, experienced maternal child health nurse. It allows the nurse to go in and provide support that new moms need to have a healthy pregnancy and to become knowledgeable and responsible parents, and just to give their children the best start in life possible.
Wonderful.
It's done through home visits, and starting in pregnancy, and then goes until the child turns 2 years old. And we've been offering the program here in Franklin and Lamoille counties since July of 2012.
So not quite 2 years, but we're coming up on 2 years.
Exactly. We're coming up on our 2-year anniversary of our first. Our first client was enrolled in July the 12th, 2012.
Wonderful. We're so glad to have that program here. And as you said, it's offered through Franklin County Home Health Agency, and we serve all of Franklin County, but in this program we also go out and extend to Lamoille County.
That's correct. Okay. Yes, the Nurse-Family Partnership program that I supervise in Franklin County and in Lamoille County.
Great. So tell us, we talked about it runs for 2 years. That's a lot of time, and it's a special, unique program in that sense, to follow from before the baby's born all the way till they're 2 years old.
Yes.
So I imagine in that time there's a lot of program goals and outcomes, but can you highlight what those are?
Well, the main goals, the overall goals for Nurse-Family Partnership are to improve pregnancy outcomes, to improve child health and development, and also to improve self-sufficiency for new moms. So we do that by, the nurse works with women to develop healthy habits during pregnancy, like good nutrition, visiting their doctors on a regular basis for good prenatal care, exercising, maintaining an appropriate weight gain during pregnancy, so that their pregnancy will end in a positive outcome. But also we do help moms who are willing to change to decrease some unhealthy habits like smoking or drugs and alcohol as well. After the baby's born, the nurse starts teaching moms about how to attach. Moms attach to their babies, naturally. But we encourage that process and give them some tools to work with that help them really bond with their babies, and give them a lot of information and tools on how to get their kids ready for what's coming up next, toddlerhood, school.
Yeah, because we're talking about, there's so much for moms, first-time moms especially. It can be a scary experience, and in certain situations there's a lot that they're dealing with at once, so to have those resources is really wonderful.
Yeah, and we actually start, talking about child health and development. We don't start when the baby's born. We start during pregnancy, talking about those things, and getting moms ready to know what to expect after the baby gets here. And then the self-sufficiency part of it, which is really important for the women in our program. Our experience has been that most women want to be able to take care of themselves and their babies. So we work with them to set goals and to develop a plan to return to school or go to work, or whatever. It's really up to them, and we just kind of encourage them and help them along the way.
Guide them, sure. So when we're talking about them, who is eligible for the Nurse Family Partnership Program?
Well, the program is specifically for low-income first-time moms. We like to enroll as early in the pregnancy as possible, but we do have to enroll before the end of the 28th week of gestation.
Okay.
So the program receives referrals from many different areas. That sort of leads into where are all these women coming from.
Okay.
We get referrals from physicians in the WIC office, school nurses, Planned Parenthood. We get referrals from the Family Center, and then we've gotten referrals from women themselves calling in.
Okay.
So.
Good. Hopefully the more we can talk about this in our community and let folks know what's available, that
That's right.
you or someone you know could benefit from this, we want to hear
That's
from
right.
them early, as
Yep.
you said. Okay.
And the nurses are going out and talking
Yeah.
to providers
Yeah.
about the program, so people are getting educated.
Yeah.
Like you hear Nurse Family Partnership being talked about more
Wonderful.
now.
Good. So our team of nurses, talk about who our team of nurses are. And
Very proud.
Yeah. who do we have on staff right now?
We have a really great team of nurses. Lisa Hardy has been with us since the beginning of the program. She's a midwife, and she has a lot of experience working with women. Jessica Boyer is an experienced labor and delivery nurse who also holds a degree in psychology, and she's been with us for just over a year now. And then Rebecca Rainville is also an experienced labor and delivery nurse. She also has some experience working with moms who have struggled with substance abuse, with drug and alcohol abuse. So, they all bring something really special to the program. And then there's myself. I'm the supervisor of the program, but I also have one client, just so I know what's going on out there. I really enjoy it. And my background is more in maternal child health. Like I've done home visiting for a long time and worked in pediatrics.
Okay.
So
good.
we have a well-rounded team.
Can you tell me about how many families are benefiting right now?
Right now we have enrolled 54 clients. We have currently enrolled 54 clients. Overall, we've enrolled about 75.
Wow,
Yeah, so.
That's really good outreach. Good. And are there similar programs to this? And you're talking about a lot of maternal child health and home care. What are some of the similar programs in Vermont, and also how is this funded?
Well, the state of Vermont applied for and received a grant through the Affordable Care Act in 2012 to implement an evidence-based program, and the state chose Nurse Family Partnership. The first 5 counties that were implementing the program were Franklin, Lamoille, Caledonia, Essex, and Orleans. And then the state, knew that this was going to be a fabulous program, so they applied for more funding, which opened up the program to other areas. So Rutland, Bennington, Washington County, Orange County, Windsor, and Windham are all now implementing Nurse Family Partnership. So it's really exciting. We're hoping that Chittenden and Addison County will come on as well.
Sure. Oh yeah, good. Well, it's good that you can have some resources and folks to connect with around the state too, and share. And it's a national program, Helping Families Thrive, as you said,
That's
an
right.
evidence-based national program. So the evidence-based, they're measuring goals and outcomes. And can you talk to us about some of the outcomes you've already seen in our short time having the program locally?
Yeah, we have been like 50. We're really proud of having 54 clients, but we are talking small numbers, but we have been seeing some really positive trends. 88% of our moms are initiating breastfeeding in the hospital. We have 100% childhood immunization rate. The nurses at the local hospitals are giving us a lot of positive feedback about women are prepared for labor and delivery who have been in the Nurse Family Partnership program. All of our moms thus far have delivered full-term healthy babies. Yeah. So we're really proud of that. One of the impacts that we've had really came about as a challenge because we ask our moms about depression. We screen for depression during pregnancy and after the baby's born. And we were finding that over 50% of our moms were experiencing depression and anxiety. So at the same time, we were looking for resources specifically for maternal mood disorders, and there just wasn't a whole lot out there, you know. So in working with our community partners, especially Children Integrated Services, the result was that 2 master level clinicians went to New York and were trained to work specifically around perinatal depression and anxiety, and we're offering those visits in the home.
Oh, wonderful.
So so just coming from one end to the other, it's been a really positive experience.
Now, when you say you're offering those in the home, is that you're offering that resource and then they come in, or is that through, it's through Nurse Family Partnership still? Like that's one of the resources that a client could receive, or that's just something you're referring them to?
We're referring them to that. So it's actually out of NCSS, and Heather Wilson and Heather Getty are the 2 clinicians, and they're fabulous. Yes, we do refer over to them, and they're building their caseload.
Yeah, I was going to ask you, who are some of the local resources that you collaborate with, and you've mentioned our referral sources, and then of course NCSS and others that you want to mention that you collaborate with.
The Building Bright Futures, one of our nurses sits on their board. We do go to our community partners meeting every month. So school nurses and all of our resources, WIC, the health department. So
well connected, and when you have those challenges you find, again, you can find a solution for them. So good. Let's talk a little bit more about those actual home visits and what it looks like, what a family could expect if they're a part of that program.
Well, I had touched on some of the services that we provide a little bit, but a typical visit usually begins with just checking in with mom and, how are you feeling today? If the baby's here, how's the baby doing? And listening, and then just stopping and listening to how things are going. And then we move into more like the health aspect of things. We take a blood pressure, we weigh the baby, listen to heart sounds if that's needed, ask a lot of health-related questions. And then when everything's okay and we can move on, then we kind of move over into the educational realm of things. Our program is really patient-centered, so the first thing that we do is address any concerns that mom has. And at the previous visit, we have a menu of services that we show to moms, and they kind of just pick from this menu. This is what I would like to talk about next time. And so
that's nice, because if they're feeling overwhelmed and they don't know where to begin, you're guiding them, but you're giving them some place to say.
I mean, they're first-time moms, so they don't always know what it is.
Sure.
You don't know what you don't know.
Right.
So, and and it goes in depth and gets a little bit more in depth, but we let them pick what they want to talk about.
Yeah.
So the visit kind of moves into that, and it's also important to note that we're not really lecturing to moms. Like, I think sometimes it sounds like we come in with all of our handouts and we're just sort of sitting around lecturing, but like during the pregnancy, we use hands-on educational supports to teach subjects like, for instance, like nutrition. We have water bottles, we have pedometers, we have blenders that we actually make smoothies with moms. We have our little doll here with our pelvis, and I can try to demonstrate this, but so we can actually demonstrate to mom the labor and delivery process and how the baby comes right out of there.
Yeah, and I'm sure that can open up a lot of questions.
Yeah, it brings up a lot of questions, and also a lot of, like, although things for the most part never go wrong, sometimes they do, and we can go over those so moms know what to expect.
Sure.
And then we let them do it, so it kind of gives them a hands-on experience of what to expect. And then we use dolls to demonstrate baby care. You can see the doll up there. We like to use our partners in parenting education book. This is like, I don't want to say our Bible, but we use it a lot.
It looks like a lot there.
Yeah, it's a huge book, but it has a lot of activities that we do with moms. We all have our own little baby doll, and that's our baby, and we sit across from mom and we demonstrate how to change a diaper, or how to read to the baby, how to sing to the baby, how to even just, you know, like do like a patty cake game or something. Yeah. And we demonstrate to the mom and talk about the importance of those things in development, and then ask the mom to demonstrate back with her baby.
Yeah.
And that's the funnest part of the visit for the moms.
Yeah. They're getting really excited at that point. Yeah.
Well, they get a kick out of it. You know, they think we're kind of, sometimes they think we're kind of silly, you know, and it feels a little silly sometimes, but it really, but then the next time when we go see that mom, or when the nurse goes to see that mom, she's, you know, doing those things with her baby. Yeah, so that's really great. And then as far as like that third goal of self-sufficiency, we bring games into it at that point. You know, like card games that talk about different goals that people have, and moms will separate which goals are really important to them, what they really don't want to change, what they might like to change later. Nice. You know, and it just helps them
to process all of that information.
Process that in their head and work on goals that are really important to them.
Wow, that's great. So there's a lot going on. How often are you visiting a family?
Well, in the very beginning, for the first 4 weeks, to build like a rapport relationship, we visit once a week for 4 weeks. Wow. And then that drops down to every 2 weeks until the baby's born, and then we go back to once a week for 6 weeks. And then it goes back to 2 weeks until the baby's like around 20 months old, and then we really drop off because we're kind of coming to the end of our relationship. Yeah. And but having said that, it's not a strict program. I mean, if you sign up for the program, it's voluntary. The mom can decide that she doesn't want to do it anymore at any time. Yep. And she doesn't have to have visits every 2 weeks.
And they're flexible. You're going to work around her schedule.
We're very flexible. Yeah, we're very flexible about listening to mom and what they want, what's working for them.
Yeah, wonderful. So you know, it's a relationship, as you mentioned, a partnership, and we have a small clip of a short clip that demonstrates that strength of that relationship. I think, and kind of shows folks. Clip. Yeah, now this isn't from Franklin County; it's from another partner in the nation. But we'll take a look at that clip.
Okay.
Thanks.
Found out I was pregnant at 18. Once I found out I was really like pregnant, this is really gonna happen. It was like, did I make a mistake? I was going to the OBGYN clinic, and the Nurse Family Partnership office was in the same building, and they had this lady come sit down and talk with me.
When you get pregnant at first, there's that feeling of, I don't know what I'm going to do, this is my first baby. And we go in and we give them the education, we give them the tools that they'll need, from pregnancy to labor and delivery to after they have the baby, all the way up until the child is 2 years old.
They push you like nobody has ever pushed anybody. And they're always there.
They really start to establish that relationship with you, and they trust you, and they believe in themselves. They start to believe in themselves and know that they can do it.
I have an associate's degree in applied health science, and the major is medical assisting. As soon as I get done with my clinicals, I'll have a job waiting for me.
It's going to be difficult, because not only did she gain a friend, I did too.
And sometimes on our visits, me and Veronica would just sit and have like one-on-one conversations about what's going on and what can I do to fix it. And then sometimes on visits, Veronica would just like say, forget it and just let's talk about something else.
You know, I always say, you plant the seed, and you wait for it to grow. You fertilize it and you wait for it to grow. That's what Nurse Family Partnership is about. And I am just glad that I was a part of Jennifer's life to be able to take that walk with her.
I just want to tell Nurse Family Partnership, thank you from the bottom of my heart for every minute you took out of your day to spend with me and my son to make our life better. There is no way that they know how much they helped me and how much I am so thankful for them. And I know that has changed not my life, but my son's life for the better.
So the clip that we just saw, there's a lot of emotion in there.
Yes.
Can you talk to us and tell us how you think about what you just saw in that video clip?
Well, I think it's really true to what we do, because you start working with a mom early in her pregnancy, and you're visiting her every week to every 2 weeks for 2.5 years. It's really easy to become bonded with that mom, and for them to become bonded with you. So it is very emotional at the end of the journey with them.
So not just the amount of time you're spending with them, but a very intimate time in their life, and you're building that relationship.
That's right. We're building the relationship, and one of our moms, a quote from one of our clients is that, my nurse is my mentor, she's my teacher, and she's my friend. And that's going to make me emotional right now, but that's an actual quote from one of our clients that, that is how it is.
Good. So talk about what is expected. You've talked about a lot of what the nurse does, but what is expected of the mom and the families in these cases?
Well, the program is voluntary, so, we do have maybe not some expectations, but we ask that moms be just open to new information, even if they don't necessarily agree with it, just to be open to listening to it and to think about it. We expect that the mom is going to be the one who drives the visits, that she takes a leadership role and decides what we're going to be talking about and when, and also who else is going to be invited into the visits. That's totally her call. Okay. It's okay to ask for information. I expect moms to ask for information. It's okay not to know. Most of us have been there, who are parents. We've been there in that first time, and it's all just to let them know that it's expected that they'll ask us questions. And also just, be at the visits. If you schedule a visit with your nurse and you need to cancel, call. It's fine.
Is it always in the home?
That is the preferred place to have the visits, because that's where they're going to be raising their child. But there are instances where we have to be flexible. One example is one mom that we in fact, I think they'll be our first graduates. When we first started working with her, Lisa started working with her, she was homeless. And so you can't visit somebody in their home if they don't have a home. But through the program, she got stronger and stronger, and she now has her own apartment. Awesome. But to answer your question, we're really flexible on that. I mean, we've done visits in the park.
Sure, yeah. But like you said, having, just like in home care in general, that setting of home is so important, because that's where they're going to be experiencing. So before we close, remind us how someone is referred to the program, because we're talking about such a wonderful program. We want folks to remember how to refer folks, or how to be self-referred.
Well, I would encourage young moms, or young first-time, or any first-time mom. They don't have to be young. To talk to their doctor about the program, talk to the WIC clinician, talk to your school nurse about the program. If you go to Planned Parenthood, ask them. They have brochures, they can give you one. But most importantly, call us. Call us 527-7531 and ask for a Nurse Family Partnership nurse. We're always there. and we'll set up a visit with you.
Wonderful. Thank you, Rhonda. Something I like to ask all of our guests, and you know, you've shared with us so many things about what you do like. Again, what is it that you like about home care and this program in general?
Well, it really is just about the long-term relationships that we can build with our families, and to see them in their setting, like meet them where they're at. I think that's really cool to see, you know, when you're meeting somebody where they're at and maybe that's not a great place, and then not us pulling them up out of it, but us giving them that leg up and that support so they can pull themselves out of it. But I would like to read a quote.
Yes, please.
Another quote from one of our clients. I said, my nurse has been a mentor, a teacher, and a friend, and that's something not everybody has. She helped relieve the anxiety of being pregnant and taught me what to expect after the pregnancy. She knows so much about what I'm experiencing and makes me feel like I can do anything. And then another one of our moms said, I take what I learned from my nurse and pass it along to other new moms, and people are amazed at how much I know.
Oh, I love it. That's wonderful.
And that's what it's all about.
Exactly. Oh, that's good. Thank you for sharing, Rhonda.
You're welcome.
Thank you for sharing all of this about Nurse-Family Partnership. And like you said, if our viewers have any questions about this program or any of Franklin County Home Health Agency's programs, you can call us at 802-527-7531 or visit us online at www.fchha.org, and of course look us up on Facebook and like us there to stay connected. I also just want to remind you once again about the special incentive Franklin County Home Health Agency is offering this month. If you catch this show about our Nurse-Family Partnership program, give us a call and leave a message on our voicemail 802-393-6798 and let us know your name, phone number, and address and what you thought about today's show. And we will enter you into a drawing for a $25 gift card to Hannaford's. So thank you for watching. Again, if you have any questions about Nurse-Family Partnership, please call Rhonda or any one of our nurses at Franklin County Home Health Agency at 527-7531. Thank you for watching today, and be well.